Breast cancer is arguably the most common cancer among women in the world and affects millions of women every year. And according to CDC, an estimated 264,000 women are diagnosed with breast cancer every year. And that makes it extremely important to know about the early signs and symptoms of breast cancer before it becomes deadly. So in today's episode, let's explore 10 early signs and symptoms of breast cancer that you should never ignore. Without any further delay, let's begin. Number 1. A painless lump. Discovering a hard, painless lump in your breast can undoubtedly stir up feelings of concern and worry. However, it's important to remember that not all lumps indicate cancer. More often than not, they are benign or non-cancerous in nature, such as a cyst or a blocked milk duct. Our bodies undergo various changes as we age and experience hormonal shifts, which can contribute to the formation of these lumps. However, if you've noticed that the lump persists beyond one menstrual cycle, it's best to seek medical advice and have it examined. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. A sudden change in the breast shape. Our bodies are incredibly unique, and it's not uncommon for certain parts to have slight variations. However, when it comes to changes in the shape or size of one breast, it's essential to take notice. Sometimes there may not be a noticeable lump, but rather an overall swelling that makes the affected breast appear larger than the other. Conversely, cancer can also cause a breast to shrink or undergo an abnormal change in shape. While it's normal for breasts to have slight size differences, any sudden change should be addressed by consulting your health expert. Your health expert may run a few tests and can provide valuable insight and guidance, ensuring that any concerning changes are thoroughly evaluated and addressed. Number 3. Dimpled skin around the breast. Changes in our skin can sometimes hold important messages. One such sign to be aware of is dimpled skin on part of your breast, resembling the texture of an orange peel. This particular phenomenon can be attributed to a tumor pulling on the skin and might be an indicator of inflammatory breast cancer. It's crucial to note that inflammatory breast cancer is an aggressive form of cancer. Therefore, if you notice any dimpling of the skin on your breast, never ignore it and seek immediate medical attention as soon as possible. By acting swiftly, you enhance your chances of receiving timely diagnosis and treatment. Remember, our bodies often communicate in subtle ways, and by looking at these signals, we can take proactive steps toward our overall well-being. Number 4. Changes in nipple appearance. Always pay close attention to any changes in your nipples, as they can provide important clues about your breast health. If you notice that one or both nipples become crusty, sore, or exhibit discharge when you're not breastfeeding, it's important to have them examined by a healthcare professional. Additionally, be mindful of any changes in nipple shape, such as inversion or flatness, where they start pointing inward. However, if your nipples are naturally inverted and have always been that way, there's typically no cause for concern unless you observe a recent change in their appearance or condition. Nevertheless, you should never ignore this sign of breast cancer and get yourself checked as soon as possible. Number 5. A red-hot area. If you notice a red or hot area around your breast, it's important to be aware of its potential causes. Inflammatory breast cancer can lead to the development of redness or a warm sensation on the skin. You may observe that the affected area appears purplish or bruised, even without an apparent cause, and the discoloration is not going away. However, it's worth noting that a red or hot area on the breast can also be a symptom of mastitis, which is an infection resulting from a blocked milk duct, commonly experienced during breastfeeding. If you come across such symptoms, it's advisable to consult a healthcare professional to determine the underlying cause and receive appropriate care. Number 6. Lumps in the armpit. If you discover lumps in your armpit, it's important to understand that breast cancer can also affect the lymph nodes in that area, as well as the collarbone region. Lymph nodes act as glands that house lymphatic fluid, which helps collect waste products and potentially harmful cells, directing them toward the bloodstream for eventual elimination by the kidneys or liver. Cancer cells can break away from the breast and often migrate to the lymph nodes in the same armpit as the affected breast. But do not panic if you come across hard lumps in this area, as they can also be caused by factors unrelated to breast cancer. Nonetheless, it is advisable to have them checked by a healthcare professional to ensure proper evaluation and peace of mind. Number 7. Nipple discharge. Discovering nipple discharge can be a cause for concern for women who are not breastfeeding. However, it's important to stay calm and remember that in most cases, nipple discharge is either normal or the result of a minor condition. Abnormalities to watch for include discharge from only one breast and spontaneous discharge without any external stimulation or irritation. Normal nipple discharge, on the other hand, is more likely to occur in both nipples and is often triggered when the nipples are compressed or squeezed. It's worth noting that some women may worsen their concerns by repeatedly squeezing their nipples to check for discharge. In such cases, allowing the nipples some time without squeezing them may help improve the situation. Number 8. Breast pain. Experiencing this kind of pain is a clear indication to seek immediate medical attention. As a tumor grows within the breast, it can exert increasing pressure on surrounding areas, leading to heightened pain. When the tumor reaches the skin, it may result in painful ulcers and abrasions. If the cancer spreads to the ribs, it can cause severe and intense pain. It is important to consult a healthcare professional if you are experiencing any form of pain related to your breast or if you notice abnormal changes in your breast tissue. Prompt medical evaluation can help determine the cause of the pain and get appropriate treatment. Number 9. Fatigue. Feeling tired or experiencing general fatigue is a common symptom of breast cancer. It can affect patients at various stages, whether they are undergoing treatment or have just been diagnosed. While chemotherapy, too, is known to cause fatigue, the changes in the body associated with breast cancer can also contribute to a persistent feeling of tiredness that doesn't improve with rest. If you are experiencing this sign of fatigue, along with other breast cancer symptoms, it's important to schedule an appointment with your doctor and get yourself checked. Effective communication with the healthcare provider can help address any underlying issues and determine the best course of action. Number 10. Insomnia. Insomnia, or difficulty sleeping, is a common but often overlooked symptom of breast cancer. The discomfort and anxiety that come with the disease can disrupt sleep patterns. Many patients struggle to fall asleep or stay asleep, often due to pain, whether it's a dull ache or sharp, stabbing sensations. It's important to address and treat insomnia, as it can significantly impact your overall well-being and quality of life during breast cancer treatment. Thank you for watching and subscribing to the channel. See you in the next video.